As a volunteer-led organization, our success reflects the unmeasurable commitment, dedication, and contribution of expertise and talents of many in the NANN community. We are excited to announce the recipients of the 2023 awards and recognize the service of several amazing leaders since last year. We strive to publish articles in our journal, Advances in Neonatal Care, that significantly contribute to providing the best state-of-the-science care for high-risk neonates, accomplished through reports of research, clinical issues, evidence-based practice, and outcomes of neonatal care. The two articles recognized as Articles of the Year for 2023 raise our attention to important issues affecting mothers and neonates and provide ways for us to improve their care. Our recipient this year for the Research Article of the Year is Maggie Hughes Brownlee for her article Screening for Postpartum Depression in a Neonatal Intensive Care Unit, which was published in the June 2022 issue. When mothers suffer from depression, the entire family unit is affected. This program evaluation project aimed to narrow the large gap in PPD screening in an at-risk population by developing and implementing a routine PPD screening and referral program in the NICU. Although the NICU is not a setting where maternal PPD screening is traditionally performed, the findings of this project support that screening is both practical and impactful. Congratulations on your wonderful work. Our recipient for the Clinical Article of the Year is Giuseppina Romano-Clark for her article, Reducing Blood Culture and Antibiotic Usage in Neonates Using Quality Improvement Science to Guide Implementation of a Neonatal Early Onset Sepsis Calculator, which was published in the August 2022 issue. Implementing antibiotic stewardship while effectively identifying neonates at risk for early onset sepsis, EOS, due to maternal chorioamnionitis is a challenge many NICU providers and staff face daily. Using the Kaiser Permanente EOS calculator, the authors collected longitudinal data to track outcomes. This project decreased blood work and antibiotic administration in asymptomatic neonates born to mothers with chorioamnionitis. Providing antibiotic stewardship, reduced blood work, and improved care for our mothers and neonates. Congratulations on your well-deserved award. The Advanced Practice Registered Nurse Rising Star Award recognizes a NANN member that exemplifies a passion for practice and is making a large impact early in their career through exemplary practice, leadership, service, and education. The recipient of this award contributes to the profession's growth in the early stages of their career by engaging in projects, publications, activities, and initiatives that demonstrate achievements that have sustained a positive impact at their institution and in the profession. We are honored to recognize Jenna Staggs this year. Jenna is an NNP at Southern Tennessee Regional Health System in Winchester, Tennessee through United Telehealth Services. She completed her DNP in 2020 and a postgraduate certificate in nursing education earlier this year. Jenna shows tremendous leadership abilities both at the bedside and away. She has served as a lead NNP, a clinical resource for residents, NICU fellows, and med students at several facilities, and an educator for multiple topics in neonatology. She mentors other APRNs and RNs and is always eager to educate on any topic asked of her. Jenna has been a presenter at an ANN conference, reviewed a chapter for an NCC review publication, and submitted a case report accepted for publication in ANC this year. Jenna's passion and enthusiasm show through every day in her actions, leadership, and service to this profession. Congratulations, Jenna. The RN Rising Star Award is awarded to an individual who exemplifies the passion for their work early in their career and makes a large impact quickly through exemplary practice, leadership, service, and education. We are honored to present the 2023 RN Rising Star Award to W. Cody Bartrug. Cody became a nurse in 2019 after experiencing a neonatal loss. He has been involved in his unit's Pain and Palliative Care Committee since completing the nursing residency program at UCSF Binoff Children's Hospital. In his second year of practice, he took over as chair of the committee and implemented new policies and procedures around pain and end-of-life care. Cody has taught new graduate nurses neonatal pain assessment and management and palliative and end-of-life care. He has also developed and taught an advanced pain and palliative care course for experienced NICU nurses. Cody presented at last year's NANN conference on a qualitative research project improving communication with parents who have experienced neonatal loss. He is currently awaiting training in triage and will pursue a national certification in care of the ELBW neonate and neonatal neurointensive care. Congratulations, Cody. We are proud of you. The APRN Excellence Award honors the outstanding contributions made by an advanced practice registered nurse, APRN, to the field of neonatal nursing through exemplary practice, leadership, service, and education. This year, the APRN Excellence Award is presented to Tracy Bell. Tracy is an actively practicing neonatal nurse practitioner at Emory University and WakeMed. She is also the neonatal APP educator at Emory University and her unit's stable and NRP instructor. Dr. Bell has shown her leadership abilities through her role as the lead NNP at WakeMed and through her role as assistant director of the NNP program at Emory University. At the state level, Dr. Bell serves as the president-elect for the Georgia Association of Neonatal Nurses, is a member of the Academy for Professionalism in Healthcare, volunteers on the board of directors for the Families Bridge to Caring Hands organization, and works with the Hope for Girls initiative of the Global Collaborating Center for Reproductive Health. Tracy is a Helping Babies breath instructor and an education consultant for the Council of International Neonatal Nursing. She provides nursing education for the Mandela Washington Reciprocal Exchange Program in Ghana. She is a senior fellow educator for the U.S.-Russia Implementation Science Collaborative in reproductive health and maternal and perinatal care. Tracy, it is our privilege to recognize your achievements. The Mentor of the Year Award recognizes a NANN member who consistently demonstrates the power of mentoring. Recipients are clinically and technically proficient, demonstrate outstanding teaching and motivational ability, and willing to share their knowledge and experience with others. We are honored to present the 2023 Mentor of the Year Award to Lisa Grisham this year. Lisa currently works as a neonatal nurse practitioner and director of the family-centered NAS care program at Banner University Medical Center and is pursuing a DNP PhD in nursing from the University of Arizona Tucson. She is the founder and director of Banner's family-centered neonatal abstinence syndrome care program, where she has cultivated numerous relationships in her local community to help serve and enhance the experience for mothers with substance use disorder and their infants with NAS. Lisa has over 20 years of clinical NICU experience and has mentored numerous nurses and colleagues along the way. She has guided many to conduct excellent patient care while continuing their own professional development and knowledge expansion. Lisa believes that once you get to where you are going, you should turn around and help the next one in line along the way. Congratulations, Lisa! The recipient of the Leadership Award has an outstanding teaching ability, can mobilize and unify others for the improvement of neonatal care, and has a vision for the future practice of neonatal nursing. This year, we are honored to present the 2023 Leadership Award to Desi Newberry. Now serving as the lead director for the MSN NNP program at Duke University, Desi strongly desires to expand her knowledge base and educate others. She has mentored many students and recognizes them to display their scholarly works at the largest national neonatal conferences yearly. As an educator, Desi remains focused on ensuring the graduation of neonatal nurse practitioners that are competent and proficient in their field. She has successfully developed and implemented several quality improvement projects that have led to practice changes with significant impact on patients. Desi has always displayed a high degree of integrity, responsibility, ambition, and professionalism for her students to look up to. Congratulations, Desi, on this well-deserved recognition. The Robin Main Excellence in Clinical Practice Award is given in honor of Robin Main to encourage and recognize neonatal nurses who provide exemplary direct patient care. We are honored to present the 2023 Robin Main Excellence in Clinical Practice Award to Jolene Farina. Jolene has been a neonatal nurse for over 25 years, working in several large NICUs across the Midwest. She is sharing her time between being a clinical resource RN and a bedside RN at Children's Hospital Colorado. She is instrumental in helping others understand complex clinical events and is known for her ability to design and implement processes that support patient safety and excellence in nursing practice. Jolene is excited to teach and guide new nurses in complex cardiac pathophysiology, treatment, and surgery, and teaches new nurses every moment while working at the bedside. Her expertise as a NICU nurse, combined with her ability to understand the feelings and stress that being a parent in the NICU holds, beautifully demonstrates family-centered care and connects with families in a manner full of passion and empathy. Congratulations, Jolene! The Distinguished Service in NANN Award recognizes outstanding and dedicated service to the association. The award honors an individual that has advanced the mission of NANN in a significant and lasting way. This year, we are honored to present the 2023 Distinguished Service Award to Sheila Gephardt. Dr. Gephardt is currently a professor at the University of Arizona, Tucson. Dr. Gephardt has been an active board member for Advances in Neonatal Care since 2011 and a section editor for the Evidence-Based Review section since 2014. In these roles, she actively reviews manuscripts, shepherds authors through the revision process, and actively selects authors for journal awards. Along with authoring editorials for ANC and mentoring her students and graduates, she has also published many highly cited manuscripts in ANC. Her 2012 State of the Science on Necrotizing Enterocolitis has been cited more than 300 times and is one of the most cited articles in ANC. In 2016, Dr. Gephardt presented the keynote at our Nursing Research Summit in Scottsdale, Arizona. Since 2012, she has served on the Research and Evidence-Based Practice Council at Banner University Medical Center, Tucson, and as a member of the Banner Nursing Research and Evidence-Based Practice System-Wide Advisory Board since 2015. Gephardt is a neonatal expert whose work tackling necrotizing enterocolitis with the GutCheck NEC risk tool and the NEC Zero bundle is truly making a difference in neonatal care at the bedside in the United States and around the globe. Way to go, Sheila! The Lifetime Achievement in Neonatal Nursing Award recognizes an individual's long-standing commitment to and profound impact on the field of neonatal nursing. This award may be presented to a NANN member, a non-NANN member, a non-nurse, or posthumously. This year, we are honored to present the 2023 Lifetime Achievement Award to Suzanne Stabler. Dr. Stabler is an expert neonatal nurse practitioner and highly respected, nationally known clinician, educator, and policy leader who has substantially impacted the care of critically ill newborns and their families. Her first position as a registered nurse was in the neonatal ICU, and neonatal nursing has remained her driving passion for over a 35-year nursing career. After working as an NNP for many years and working on her DNP in the mid-2000s, Suzanne began her career path to establish the neonatal nurse practitioner population as separate and distinct from pediatrics and engage in focused policy work to establish and support the NNP scope of practice, educational standards for NNP programs, and workforce analysis to help improve access to NNP care. Along with holding clinical positions, her career path has involved serving as a clinical preceptor and faculty at highly respected nursing institutions. Dr. Stabler has been instrumental in the publication of professional literature that defines the neonatal APRN role, identifies barriers to practice, and the future direction of the role. She has served as an expert clinician with academic medical centers, community hospitals, children's hospitals, and rural critical access hospitals, which informed her understanding of gaps in clinical care across the continuum of care and has provided an impetus for her policy and advocacy work. Congratulations, Suzanne!